Namaskar, Jai Hind. I am Dr. Narinder Taneja from Bhiwani, Haryana, President North Zone Ophthalmological Society, past President Haryana Ophthalmological Society, and Senior Consultant Ophthalmology, Center for Sight, Bhiwani. Every year from 25th August to 8th of September, eye donation fortnight is observed in our country. The purpose of this fortnight is to create awareness about eye donations, to get pledge forms signed by people. But please note that it is not essential that a person who has died, and if he has not signed the pledge forms, he cannot donate. It all depends upon his family. If the family wants eyes can be donated, they have to contact the nearest eye bank and they will make arrangement that eye is taken out within 6 to 8 hours. And reverse may happens, a person has signed pledge form but he has not told about his pledge to the family and his eyes may not be donated. When a person dies, his eyes should be closed. The body should be kept away from sunlight, preferably in a very cool room, and eyes should be kept in a bag on his eyes so that the temperature is lowered and eyes are preserved before they can be taken out. What is cornea? This is a glass-like structure in front of the eye. When we look forward, our iris is visible. Iris color is brown, sometimes light brown or sometimes even blue. That is covered by a glass-like structure about 11 millimeter in size, that is called cornea, and this cornea is used for corneal transplantation to treat corneal blind persons. There are about 11 lakh corneal blind persons in our country, and every year 50,000 new ones they are added. Last year in our country 48,000 corneal transplantations took place. When cornea is donated, the quality assessment is done and it is kept in a preservative, and it is better if the cornea is used within 48 to 72 hours. However, it can be preserved for a longer period also. Quality assessment of the cornea is done. 40 to 50% of the corneas they are suitable for transplant purpose. So last year more than 1 lakh corneal donations were done and 48,000 corneal transplant operations were done. However, it is required that we should do about 1 lakh transplantations, and for which we need more than 2 lakh donations, as 40 to 50% only will be used for transplantation work. Please note that a person can donate his both eyes, and then both eyes can be used for 3 persons each. That means a person can give benefit to 6 persons. There are different layers of the cornea, superficial layers and deeper layers called Descemet's membrane and endothelium. See, both of them can be used separately. So if 2 corneas available, 4 persons will be benefited. Similarly, there are stem cells near the limbus at the junction of the white portion and the cornea. They are also used in some of the patients. Recent survey was done National Society for Control of Blindness and Visual Disability in 2016 and 19. It was found out that in persons above the age of 50 years, 8.2% they are blind because of corneal problems, while in age 1 to 49 years, more than 37% they are blind due to corneal problems. As I told you, 50,000 persons they are added to the backlog. Now let us see, can we do something to prevent corneal blindness? Because prevention is better than cure. So let us see what are the various steps by which we can prevent corneal blindness. Vitamin A deficiency is one of the commonest causes of corneal blindness. Newborn should be breastfed within 1 hour after birth. The initially secreted thick milk or yellowish looking milk by the mother that contains large quantities of vitamin A. This is secreted for 2.5 days, and this vitamin A, high quantity of vitamin A during the first 2 to 3 days takes care of child's need during the first 6 months of life. When child becomes more than 6 months, he should be given boiled and massaged green leafy vegetables. And as his age advances, then slowly other things should be added like banana, green vegetables, yellow fruits, papaya, pumpkin, mangoes, carrots. They contain high quantity of vitamin A. Besides curd, milk, eggs, they also contain large amount of vitamin A. When child is 9 months of age, he should be given measles vaccinations. In government hospitals, MR vaccination is done, measles and rubella. The vaccine is against 2 diseases, measles and rubella. 2 doses are given, one at the age of 9 months and first booster at the age of 18 months. In private setup, MMR, measles, mumps and rubella vaccine is given. 3 doses are used, one at the age of 9 months, first booster at the age of 15 months and second booster between the age of 4 to 6 years. MR and MMR both contains rubella vaccines. Rubella itself is a very mild disease, but if it happens to pregnant mother during first 3 months of pregnancy, it can cause serious congenital births, including serious congenital defects, including defects in the heart, eyes, ears. So this vaccination is very important for pregnant mothers. If she has taken in childhood, this is fine. If there is no history, then vaccination should be given during the preconception period, at the time of marriage or just before marriage. When a child goes for MR vaccination at the age of 9 months, in government setup, all the health centers, all the vaccination center of the government, they have bottles of vitamin A, and 1 lakh international units is given to the child at the age of 9 months. 1 lakh means 1 ml of that solution. When child again goes for second dose of MR along with other doses like DPT, polio, then another dose of vitamin A is given. Vitamin A not only helps in good eye health, but also helps in maintaining the immunity. Further, 8 more doses are given at government centers every 6 months. All last 9 doses are 2 lakhs, first dose is of 1 lakh. Then coming to when the child becomes little older, 2 years, 1.5 years or 2.5 years, it starts playing with the toys. The toys should not be pointed. Any toy which is broken, that should be removed. Some objects like scissors, knives, needles, compass, they should not be within the reach of the small children because they can injure themselves, they can injure their eyes. Then during festivals like holy. This applies for everyone, for adults, children. If the holy colors get into the eyes, whether by a pichkari or whether it is dry color, it can cause corneal injuries and beside injury to the other eye structures. Similarly, if one is hurt by a balloon filled with colors, that will cause serious eye injuries. Similarly, when there is the Shara Diwali festivals, children and adults both play with firecrackers. The children should be specially taken care of. They should not play themselves with firecrackers. Adults should be there whenever the children they are playing. And preferably they should not play with firecrackers, but even when they have to, these should be done under the supervision of an adult persons. Bow and arrow injuries are very common during the Shara and after the Shara. When Ramayana serial was first telecast in 80s, so many children they got serious injuries because of the arrow injuries. So the festivals they are for happiness. They should not cause blindness to anyone, whether it is Holi, whether it is Diwali. Now we talk about farmers, farming, harvesting. When the farmers go to the fields having large crops like maize, sugarcane, jowar, bajra, or if they are harvesting wheat or rice, then they should wear protective glasses, because during every harvesting season people come with eye injuries on the cornea. Then they use drops purchased from them from the market of their own or prescribed by quacks or prescribed by chemists, and most of them contain drugs called steroids like dexamethasone, betamethasone, prednisolone, and they cause harm to the eyes. So one should not, if any injury has happened, they should consult an doctor. They should consult a doctor, whether an eye surgeon or not, preferably an eye surgeon. And medicine should not be purchased of their own from a chemist or gotten from an unregistered medical practitioner. A minor looking eye injury can be very serious, whereas a very minor injury, like sometimes patient come with red eyes, they are hemorrhages in the subconjunctival region. So they make the patient scary and they immediately report to the doctors. Most of the injuries they are not serious. Redness disappears of their own in 3 to 4 weeks. But other injuries which are not looking serious, by neglecting them they become serious and they can cause corneal ulcers and ultimately can cause blindness. Similarly, if one gets injury by tail of a buffalo or a cow, one should report to the ophthalmologist or eye specialist. Then he will look whether there is any eye injury or not, and whatever drugs are required, that will be prescribed. Now coming to, if a child gets some foreign body in the eyes, he should not rub. Whether he is a child or an adult, most of the persons they start rubbing the eyes. And if the foreign body sticks inside the lids, and when you rub the eyes, injury occur on the cornea. That causes corneal abrasion leading to corneal ulcers, ultimately corneal scars and blindness. So if there is a foreign body in the eyes, if child is in the school, he should ask his teacher. If he is in the house, he should tell his parents, and then they will see whether there is the foreign body is clearly visible, and if possible they will remove it. If not, then they should visit a ophthalmologist. Eye injuries should not be taken mildly. Who is an eye specialist? One becomes an eye specialist only after taking his MBBS degree. Then they have to do DOMS or DO or DODNB, which is of 2-year durations, or MS or DNB, which is of 3-year duration. There is also a secondary DNB, which is after a diploma course, and this is of 2 years. Other degrees of similar kind, FRCS ophthalmology, they can also be there, but FRCS is only in the other countries. A disease called trachoma used to be very common in our country. About 40-45 years ago, when I had joined government service in Punjab, I used to go to schools to check the children's eyes, and almost everyone used to have trachoma. But nowadays trachoma has almost disappeared. It is very rare to see trachoma patients. At least in our area in Haryana, trachoma is not seen. Very infrequent. This chronic trachoma leads to misdirected cilia or inverting of the lid margins, so that the cilia or the eyelashes, they get misdirected. They constantly rub on the cornea and ultimately lead to corneal ulcers and corneal blindness. One should, to prevent this disease, one should wash his eyes frequently, 3 to 4 times a day, with clean water after washing his hands. Use of surma was very common about 40-45 years ago, but nowadays I see seldom children having surma in their eyes. Surma does not give any benefit to the eyes, but if a common silai is used to put surmas, then infection can be transmitted from one person to another. Sometimes these surma sellers or eye drop sellers, they come in the buses or the trains, and they tell that every eye disease can be cured with this surma. People come with severe problem in the eyes when they use this surma, because it can cause chemical injury, besides it can cause infection. Friends, when you are going to the market, you may be seeing that somewhere welding is being done. One should not look toward the welding with your naked eyes. The person who is doing welding, he is wearing a special glass to take care of his eyes, and if you are watching welding being done, your cornea can be burnt by that strong light. Friends, I have tried to give some high points about corneal blindness prevention. If you have any doubt in your mind, you can write to me in the inbox. I will try to answer you. If you have liked this video, please like it and share it among friends. Thank you. Jai Hind, Jai Bharat.